Number one thing, don't take advice from some asshole on the radio.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Your show was better when you had medical questions. Hey!
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic echographic and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio. Now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medical practitioner who keeps the weird alternative medicine wackos at bay. Hello, Dr. Scott.
Hey, Dr. Steve.
And we also have my wife, Tacie, the professional WebEx attendee. Hello, Tacie.
What's up?
This is a show for people who would never listen to a medical show on the radio or the internet. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call, 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine, at Lady Diagnosis, and at DrScottWM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Or go to our merchandise store at cafepress.com/weirdmedicine, where you can get a crystal stool scale mug for that crazy gift exchange at work. Or a Flatus flute. Go to flatusflute.com. I get nothing from that except amusement.
Either one of those gifts with a couple lottery tickets
Is a pretty good
gift.
One of those white elephant
People
Christmas
fight over
gifts.
lottery tickets, not so much the stool scale mug, but
The Flatus flute now. You can just pass it around.
Nobody's
and
fought
let
over
everybody,
that.
Let everybody make it toot.
it's very COVID friendly.
Most importantly, we are not your medical providers. Take everything with a grain of salt. Don't act on anything you hear on this show without talking over with your doctor, nurse practitioner, practical nurse, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, clinical laboratory scientist, registered dietitian, or whatever. All right, don't forget to check out Dr. Scott's website at simplyherbals.net, simplyherbals.net. And please don't forget stuff.drsteve.com. 'Tis the season for Christmas, Hanukkah, Kwanzaa, whatever. And it's you can get everything that you want at stuff.drsteve.com because it's basically a alias for Amazon. So just click through to Amazon, and then that helps us. Or you can scroll down and see all the crazy stuff that we've talked about on this show, including treatment for neuropathy, the Navage, the that crazy sex toy that I can't even remember who recommended that to us. All that kind of stuff is at stuff.drsteve.com. Check out our wine club at wine.drsteve.com. It's, when I say our, it's the one we're members of.
Does the radio show really promote sex toys?
No, not really, but it's just on there. We had talked about it on the show.
Well, I'm so proud.
Well, we have. What about the Flatus flute?
I am more proud of the Flatus flute.
Okay. It could be a sex toy, I guess.
Well, it's just a way for people to enhance their pleasure in the bedroom. That's all. It's between consenting adults.
Oh, God.
Okay, or not. All right. Okay, but you better go look at it quick because I'm going to take it down.
Oh, I'm not
Tacie
the
says
one
no.
who's the boss here. I'm just saying. I just
really
disappointed in
that's
everyone's.
news to me. So check out the wine club that Tacie and I are members of. That's actually quite delightful. Is wine.drsteve.com. It's naked wines. You get intimate. Well, not that intimate.
Intimate. Here we go.
You get pretty intimate compared to like, the Gallo brothers. Try interacting with them on their website, but you can interact with the vintners, and it's pretty cool. And you get free stuff. The other day, they just sent you a free bottle of wine for no reason.
Oh, did I drink it already?
Yeah. Well, it's
Oh.
in your thing.
Oh.
So it's really cool. Wine.drsteve.com. It's a good gift to give somebody too. And then tweakedaudio.com. I just bought some wireless earbuds from them. I used the order code FLUID, and so I bought 2 or 3 of them. They were $100, and it took off $30.
And if you have children, you're always looking for those.
Yeah, and these are quality, and they got the best customer service anywhere. And if you want to lose weight before the big holidays, go to noom.drsteve.com. It's noom.drsteve.com. Not a diet. It's a weight loss program, but it really is a psychology program that helps you change your relationship with food.
It's pizza night.
And then, of course, Dr. Scott's website at simplyherbals.net. So let's talk shingles. Shingles can kiss my ass. You know what else can kiss my ass? Shingrix, the vaccine, because I got it. I suffered for 4 days, and I got shingles anyway. Although I'm really being facetious. Get your shingles vaccine anyway, because I'm expecting to have a much less severe reaction than Tacie did when she had shingles, for example.
I hope so.
Me too.
So I got it. I get it. And then Tacie's like, "Oh no, like it's cancer." Something. It's like, please stop doing that.
Don't be supportive of your husband, whatever.
I don't know.
Don't care. You know what? Just go jump off a bridge, whatever.
Well,
do
by
whatever
God,
you want.
Well, by God, maybe I will.
Well, I want you to. So,
Well, the good then we're fine.
Hey, I do have a story.
Yeah.
Oh, cool.
A New Orleans super spreader swingers convention leads to at least 41 COVID-19 infections.
Oh my goodness.
Jeez Louise.
That sounds like a fun party. Okay, and is that it? You're just going to read the headline?
Yeah.
I mean, it's fine.
Mm-hmm. Yeah, that's it.
Yeah, attendees of the 2020 Naughty Nollan Swingers Convention swayed in place at their tables and flirted behind masks from a distance. They still got it. After being tested for coronavirus and agreeing to wear masks, 250 people checked into a New Orleans hotel for the Swingers Convention on November 14th to reconnect a community separated by the pandemic. I'm wondering about that, if swingers were having a hard time. No, really. I mean, because it's a hard time.
Yeah.
They like to get together in clubs and stuff. I mean, I don't want to overgeneralize, but, it's hard to swing with people you don't know particularly.
But even with people you do know, even as
Right,
friends,
right.
like we had a nice little
Why does
dinner
your mic
last
sound
night.
So terrible. Go ahead. Keep
And
talking.
then that night someone ended up with diarrhea. Not me.
Right.
I don't want that image in anyone's. I mean, although it's not like I haven't had it, but anyway. So no matter what we do with people, there's always a scare. You know,
Yep.
always,
Yep.
always a scare.
Yep. Well, you look at your microphone and make sure that it's set properly. It should be on flat and 0 dB because I'm having trouble with your mic tonight. Yeah.
Yes, it's set properly.
Okay, maybe I'm just hearing. Does she sound weird to you?
No.
Sounds muffled to me. Okay, all right.
sounds
Maybe it's
weird.
just my ears.
I like that.
Yeah, it's so they went through all these precautions, which are the right things to do, but you have to do more than that. So, for example, we are watching the Great British whatever
Baking show.
and then we're also watching some other reality shows like I don't know
The Bachelorette, the best show ever.
right, The Bachelorette, and
90 Day Fiancé.
well, they didn't quarantine there. They're all in masks and stuff. But
No, but we watched
But
it.
they have they put them in quarantine for 10 days and then did serial tests on them so that they could all get together and put the crew in quarantine. Anybody that's going to be on the show had to be in quarantine for a period of time and then have serial negative tests. And then they can all make out and hug or, work
There's
together and all this
plenty
stuff.
of making out.
Yeah.
Plenty of it.
Yeah. Well, on The Bachelorette, not so much on the baking show.
No,
but,
not on the baking show.
But so I am. So that's the way to do it. These guys kind of did. You can't have a convention and then isolate everybody for 2 weeks before the convention. You just can't do it. who can do that? So you've got 250 people, and apparently somebody was infected, and even though it seems like they did all the right things, they were wearing masks. If you're swingers, you're probably not socially distancing, at least not the whole time. And anyway, city did not require a permit for the annual swingers convention, which was a little more than a tenth of its usual size. Oh my God, they usually have 2,500 swingers. Well, honey, I know where we're going next year. We're going to New Orleans.
I'll just let you go, sweetie.
Oh yeah, I don't think they are cool with just dudes just showing up.
Oh, I guess. So I need to be in attendance.
Yeah, you're my bargaining
You can take
chip.
Scott.
Yes, that's right. I'm sure that would go over great too. They'd be like, "Ooh, gross."
Yeah. So anyway, yeah. Well, anyway, let's get back to me.
Sorry.
That's okay. Shingles. So let's talk a little bit about what shingles is and why I'm a little pissed because of this vaccine. It's supposed to be 96% effective. I guess I'm in the 4%. But things have been a little stressful. I had to work all through Thanksgiving, and we had a ton of patients were just slammed constantly. My phone is constantly going off with this emergency and that emergency. I mean, it hasn't stopped in a while. And the next person who tells me that this COVID shit is a hoax, I'm going to punch them in the nose. Because, I mean, our hospital is...
Sick of it. I'm just sick of hearing that.
Our hospital is full. And we're looking at getting even fuller over the next few weeks. But shingles is a viral reaction that causes a painful rash. So last night, I thought I was laying on something, or I'd scraped my back, or felt like I was laying on like a pistachio shell. Okay, that's what it felt like. That sort of sharp pain, but I couldn't move it. And then I rubbed it, I tried rubbing it, and it's like, is there something on there? And then I'm like, oh my God. So Tacie looked at it this morning, took a picture of it, but there was just one of them. And I said, it could be just a zit, but it doesn't feel like any kind of zit I've ever had before. And then it just kept on today. And if I'm just sitting, I don't notice it. But if I move around at all, I can tell it's on my left flank. And Tacie and Scott looked at it tonight, and what you said there were 5 of them now.
Yeah, about 5. I mean, you would not let me count them. So
you can count
I got
them.
a
We were
visual.
just going,
5.
Okay.
I'm.
Oh, for fuck's sake!
Well, that makes me feel worse.
Everything is just gone to hell. Everything.
Yeah.
That's the fucking truth. Everything's gone to shit.
Well,
For the most part.
I guess. There's some things that haven't. COVID-19's been good for one thing. It's encouraged the adoption of telemedicine everywhere, which is a good thing. I can't think of too many other good. Oh yeah, no meetings.
Well, the other good thing I think it has done is cut down the onset of the flu season.
Yeah, I think we talked about that last week,
yeah.
but I think that's true.
Well,
I haven't seen a single case of influenza or of viral gastroenteritis, knock on wood, or any of that stuff.
No,
so it's
either.
pretty interesting, isn't it? So shingles is caused by the varicella zoster virus, which is the same virus that causes chickenpox. And once you've had chickenpox, the virus retreats. Your body gets rid of it, except for in one place where the virus is inactive in this nerve tissue real close to the spinal cord and sometimes close to the brain. So it could be up in the head. And then when the shingles comes out, you get it in your eye, or sometimes it's in the trunk, and then that's why you get it, across your torso, right?
So I touched your dirty little shingles.
Right. So
Does that mean that I'm going to get it
You're in
again?
trouble now.
no, absolutely not. You
Because I
can't-
feel it on my fingers.
Okay, Scott could lick your fingers, and neither one of you would be affected by it, because you've both had chickenpox. You cannot give shingles to another person,
Right?
Because they have the intact immune system, and the virus just sits there, and then your body fights, says no, hell no.
Mm-hmm.
We have our own virus embedded in our spinal cord. Thank you very much.
Very
So it doesn't talk.
Territorial shingles.
Yeah, we
Okay,
can't. We
so
don't
it doesn't
need you.
talk to my shingles.
No,
and-
not at all.
No.
Now, but what you could do is if you touched a kid who had not been vaccinated or an adult who had never had chickenpox and never been vaccinated. You could give them chickenpox.
Yeah. You could give them chickenpox.
You can't give them shingles.
Not shingles. Yep.
Okay.
It's weird.
Yeah.
So shingles comes because you had chickenpox, and it retreats into these little nerve ganglia, and then when you have a period of massive stress or for whatever reason your immune system turns its head for a second, then it comes out. It will always be in one nerve root unless you've got a really effed up immune system, in which case you can get disseminated shingles. That's where it goes everywhere. But normally it will follow one single nerve root, which is how you know it's shingles, because it's always on one side of the body or the other. It's never on both.
So where will your little nerve root go?
My nerve root is, I can count it up. I can tell you exactly where it is. So there's the lesion. So mine is at the probably the 5th thoracic vertebra. So, there's 12 thoracic vertebra, and the spinal cord comes down, and between the 5th and 6th vertebrae, there are these holes that are made by the interlocking nature of the vertebral bodies. The top one interlocks with the bottom one, and they interlock in such a way that there's little holes on either side that the nerve root comes out. It's cool as shit. And so that's the nerve root where mine was living, and that's where it's coming out. And it will come out right close to the spinal column, and then it will kind of come around and go down as that nerve root.
Into your privates?
No. No, as it'll just go down slightly, because the nerve roots come out and then rotate down as they come to the front.
So you already know where it's going to be.
Yep.
Okay.
Yep. Yeah, it'll start at around T5, the 5th vertebrae, and then work its way around my flank, and then end up slightly lower than that, right above T7. Around my umbilical cord. That's right.
Can I pitch in here? It's funny you say that's where it feels like, because when I looked at it, it looks a little lower than that.
Oh, is that right? Okay.
It looks T10ish. T10ish, yeah.
Well, okay.
Yeah, it's close to that floating rib. It's close.
Yeah, you might be right.
It's a little lower than what. And the only reason I bring that up is because when you have pain in the back, there's not as many sensory nerves. Sometimes you get a feeling.
Well, here, let me stand up, and I'm going to point
at
the vertebral body.
Yeah, it's just.
Which one is that?
Nobody can see that shit. You're not even.
Yeah, about 10. Yeah, you're about 3 or 4 down from 7.
You can see it,
I
Tacie.
can see it. I can see through that.
Whatever.
About 10ish. Yeah, it's down below your scapula.
Okay.
About 3 or 4 levels.
Okay. Yeah, there you go. Well, anyway, yeah, it is weird. It's hard to
figure out
for you to tell on your own body.
Yep.
That's right.
Yeah.
So, yeah. So anyway, it's not life-threatening. It can be very painful. Mine is not very painful yet.
Mine was very uncomfortable, not very painful. But
right.
I really could have gotten a couple of days work off with it. Shingles is a good excuse.
It is a very good excuse.
But
especially if you tell them you're contagious.
It was it was too late by the time I figured out what it was before I said anything to anybody. Because it was in a very private place.
Right.
I think I just figured out what was wrong with your
Well, it's not anything I did.
I know. Okay. I just wanted to make sure.
I guess I'm fired up today because you're just a little bit of a butthole.
I am.
Well,
fine.
I don't feel good.
Well, no, you don't feel well. The crappy thing is, and we'll get to this.
But how I am. I can't. Sympathy. I can stand empathy. I can't deal with sympathy.
Mm-hmm.
So,
and
especially then it gets me stressed out thinking that I'm worse than I am.
Well, and then you had 4 days of misery after the shingles vaccination.
When I do get cancer, then how are you going to act then? So that's all that.
I'll
goes
just
through my
laugh.
We have a plan,
and you'll feel better.
We have a plan, don't we, Tacie?
Yeah,
we have a plan.
Good.
Yeah, you won't suffer. You'll be fine.
Anyway,
it'll be over quick.
It'll be quick.
So shingles can kiss my ass. Tacie, there's 2 bad places you can have it: in the grinds. It's what we call it here in Tennessee, which would be the private area, or on the face. And where was yours, Tace?
In the grinds.
Not on the face, right? Not on the face.
I was for sure that Steve gave me herpes, and we had some talking to do.
Or your boyfriend gave you herpes.
Or that. Somebody had some talking to do.
Because I was like, we got some talking to do, that's for sure.
So they did that test. They
Yeah.
did that test because I wanted to know. I mean, hello.
Yeah. Yeah, there's another thing that masks as genital herpes called, and it's been a long time since I've seen it, Bechet syndrome, B-E-C. Oh, boy, it's that weird French C thing. Let me see if I can find it. B-E-H-C-E-T. Look that one up, Scott.
Yeah, I remember it, but I don't remember what the hell it is.
And I remember that I saw one of those, and it causes blood vessel inflammation throughout the body. But every once in a while, if you get the lesion in the private area, you'll think that person has herpes, but it's not. Let me see. Of skin.
I think I've seen this one time.
Have you?
Yeah, one time.
Yeah, mouth sores, eye inflammation, skin rashes, and lesions, and genital sores. So yeah,
Yes.
I got fooled by that one once.
Sore all over you. I've seen shingles one time on both sides, on the guy's back. I've only seen it once.
It could happen, particularly if they're really older and their immune system sucks.
Yeah.
Yeah, but risk factors that increase your risk is being older than 50, anything that weakens your immune system, anybody undergoing cancer treatments, or taking certain medications. The only category I fit into is being older than 50. And the reason you care about it, besides the fact you could give somebody chicken pox, is that it can cause stimulation of the pain fibers that never goes away. And it's called postherpetic neuralgia. And that can last anywhere from months to years to the rest of your life. Mm-hmm. And so they have found that if you treat it quickly with valacyclovir, you take a gram 3 times a day. It's Valtrex, what you would use for genital herpes or cold sores and stuff like that.
It's an antiviral.
Yep.
Yep.
And sometimes you can throw in steroids along with that, and that will decrease the risk of ending up with postherpetic neuralgia. If it's in your face, obviously you can get vision loss.
So how bad is it on a scale of 1 to 10?
Mine?
Not that I care. Yes.
2.
I'm just wondering.
2.
Quit bitching about it.
I'm not bitching. You turd. Oh, my God.
And keep your damn dirty fingers away from your nuts just in case.
Yeah, no, it'll totally be fine. Yep. Yeah, it's about a 2. My stupid neurogenic claudication is right about a 1 right now. So.
Well, I don't know what that is.
Well, that's the leg pain that I have from the narrowing of the spinal column at L5S1 that I have. Due to a thing called spondylolisthesis, where the I'm just falling apart, Tacie, and I apologize. You married an old man, where my vertebral bodies are no longer laying on top of each other, but that one is slipping off the other one, and as it does that, it's pinching the nerve root, and when I walk, I get pain in my leg that can be pretty severe. And I went through physical therapy, and it's a whole lot better than it was. My only concern is I could live with it like this. I don't think I'm going to have surgery for it being this bad. But I used to walk the shit out of them at Disney. I mean, Tacie and the boys would be like, "We're tired," and I'm like, "No, we're still going to see Woody," and stupid crap like that. But I don't feel like I would be the one that was driving that train anymore.
So there's but there are some more invasive things that help with the spondylolisthesis,
like what?
And certainly with the stenosis. The acupuncture does help with the TENS unit on it.
Why am I surprised?
You do need to go try
yeah,
that.
I do want to come see you.
I mean, it's what I do.
No, I know. I
do
know,
it every day.
Of course.
And epidurals.
Yeah, if you're gonna go to Payless, you're going to get a new pair of shoes. If you're going to go to Scott, you're going to get needles stuck in your.
And it feels so good.
It does. Yeah, I have been actually for real meaning to do that. So tell me what else you would do.
The other thing would be an epidural. Just prior to you.
Have had 3 of those.
Did it help?
Yeah.
Oh, good. Yeah,
absolutely.
So that's pretty common.
So when he says an epidural, what they did was my buddy, who is a physical medicine rehab guy, put me on a C-arm, which is a thing where he can see through my body using X-rays. And he would line up the C-arm exactly where he could see the holes. And when he does that, he knows all he has to do is go straight in line with the projector and the receiver, and the needle will go right in, right? So he did that.
Hopefully.
Yeah. If he knows what he's doing, but he can watch it too, and then he injects the dye, and he can watch it go in.
Sure.
And he did a perfect job. And the first time he did it, it was like, oh hell, I'm cured. You know, but then after about a month, it came back, and then he did 2 the next time, and
2 levels or 2 sides?
2 levels, 2 levels.
Okay.
And it helped it still feels better than it did. But I didn't get that instant relief that I did the first time.
Very consistent with epidurals for that.
Yeah.
Typically, the first one works super great. Second one, not so great. And third one, it can be good, but there are a lot of times at that point in time, you have the epidural and you get up and it's no better at all.
Yeah.
And that's kind of the norm.
Yeah.
You know, they could depending on where it is, a small surgical procedure like laminectomy would be something that could provide some.
Yeah, well, let me tell you
relief.
what they're telling me they want to do.
Fusion.
They want to go in from the front.
Sure.
And they want to jack it up to put it back into where it's supposed to be. Put spacers in there. Take the disc out completely, the disc between the 2 vertebral bodies. Put in spacers in there. And then flip me over. To go in through the front to get to my spine, they got to move all my guts aside.
Sure. It's a big deal.
It's a big deal.
It's a big deal.
And then they would flip me over, open me up again, and then put a cage in there, put a bunch of rods and screws and stuff to hold it in place. So that's what I'm trying to avoid.
Yes.
But I don't want to wait so long that now when I have to have it done, I'm too decrepit to have it done.
Oh God, I'm in so much trouble.
You're in trouble. Yeah, but here's the thing too.
You're not in trouble. I'll take care of it. If I get that bad, you won't have to worry about me.
Oh, that's terrible too.
Yeah, I mean,
there's just no way out.
I can't win with her.
No, I mean, obviously that is a massive surgery. But there's, the big, and you know this as well as I do, but not everybody knows it. The biggest thing we'd be mostly concerned with is motor loss.
Yep.
Or sensory loss. So,
which I have.
If you have motor loss and sensory loss, then we got to pay a little bit closer attention to it for sure.
I have more sensory loss than motor loss. I don't have a dropped foot. But one of my friends who had this kind of same problem, that person has foot drop because they waited too long to operate. And so, it's a waiting game, or it's a game kind of.
It is, yeah.
When is the exact right time to do it?
Yeah, and if the pain is not intolerable,
it's not intolerable.
Typically, we'd say, "Hang on, let's at least try."
Yeah,
and sometimes extended PT, where there's really great pelvic floor tightening will help.
Yeah,
because that'll help.
She's got me doing that
sometimes to push that vertebra back. What about an inversion table? Have you tried one?
Well, I asked about that. Nobody was really thrilled about that. I thought it'd be a good idea. My physical therapist, she's been working. She said, "Look, you can wear a brace, or you can just build one out of muscle." And so that's what we've been working on, is building up abdominal core muscle strength. So, but anyway, all right.
Let's
Anything
call
else
this show
about me?
Steve's Medicine.
Yeah. Let's see.
Steve's
should we talk about
treatments for
my dental implants?
Next, we got to finish treatments for the shingles.
Okay, yeah, go.
Because that's one thing we didn't discuss. In addition to the antivirals, which is you have to do.
Yep.
The lysine, L-lysine, which is
it's a good idea.
Counter, that'll help block the receptor sites. Because what happens is the virus will attack the receptor sites on the nerve and start breaking it down, which causes a postherpetic neuralgia, right?
Well, right. Well, the virus is made of polyarginine. That's viral code is polyarginine, and lysine is an analog of arginine. And when you overwhelm your system with a lot of L-lysine, it's harder for it to make its code.
Kind of blocks those.
It blocks the enzyme in the virus that allows it to build its code.
Okay. Yeah. Well, but those are hugely important to get. If you get those on board quickly, you'll do super great.
Yeah.
And then of course, if you continue to have pain, what I do,
tell me,
shingles, is it's a technique I call surrounding the dragon. The shingles is a dragon.
Yeah.
And I'll go from your spine. I'll do a nerve block at your spinal column where the root comes out.
Oh yeah.
And we'll do a nerve block there. And then what I do is I actually take needles and stick them around the
I'm in.
rash
Okay.
and put electrical stimulation to it.
I'm all in on that.
99 times out of 100, it works extremely well.
Really?
Yeah.
Is that data you just made up just now, or did you actually do data? I mean, is there really a study that says it's 99% effective? Because that's an outstanding number.
It is an outstanding, but I am outstanding in my field. All right. No, I'll look it up. I don't know the exact numbers.
Yeah.
But the acupuncture with stimulation, electrical stim, is
Well, I'll
certainly
do it.
recommended for.
Hell, I need everything.
You do.
Yeah. We can put you on a stretch table. We'll make you 3 or 4 inches tall. That might fix your.
Do you
back
have one of
too.
those?
No, but I can make one.
Well,
I've got a truck and a chain.
That's all you need.
That's right. We'll fix
And
him.
a thermos.
In Hillbillyville, we'll fix him.
so this guy called, and I don't know who he is. His name is Radiano, and he sent us a bunch of questions. He said, since I heard that episode, maybe number 31, when you were remembering losing your virginity. I don't think you were here for that one, Tace.
Oh.
He said, I hate my voice, but I'm sending you spicy questions for the show and funny stories from Croatia when I was a kid. So he sent 5 questions. I said, we will call you the Croatian Tacie Deloach. And he said, who is she?
There you go. Poor Stacey.
Poor old Stacy. So I haven't listened to these, and I thought we would just try them and see how they go.
Are we freestyling it?
Yeah, we'll freestyle this. Okay, first thing, we got to get Ronnie B in there.
Number one thing, don't take advice from some asshole on the radio.
All right, very good. Let's see here. Uh-oh. Oh, boy, here we go. Oh, no. Okay.
Hi, Dr. Steve and everybody in the studio.
What?
I love the show, and I have a quick story and a few questions.
I bet that he did not intend for it to sound like that. Let's see if his other ones sound like that, because when he recorded this, I bet I know what it was. He recorded it on a 50-cycle European computer, and now we're playing it on a 60-cycle European computer, so it's 1/6 faster. That's what I'm guessing. Let's see.
Or he just loves helium.
Yeah.
The second question is...
Oh, no.
Helium.
Radiano. Oh, I planned the whole show around this. Let me see. Here's another one.
Shit or human shit.
Well, let's listen to
We were
first.
kids between 10 and 12, and we were playing with the ball in the park.
I can't understand them good enough.
And sometimes...
Dude, you got to send them again. Email me, and I'll tell you how you can fix this.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
Dang it.
Well, that was a great show.
Great
show.
Show's over. Yay.
Let's go.
Time to go watch the Hallmark movie.
Surely Steve's got at least another
I do. I've
medical
got all
issue
kinds
again.
of stuff.
Yeah. Well, we hadn't talked about his teeth yet.
Oh, his teeth are
No,
next.
that is true.
And I
Hi,
talk-
Dr. Steve.
Oh.
You know how they say that you're supposed to fast before surgery with anesthesia? Well, what happens when
you eat like a endless pasta bowl or fish and chips, and then you get into a car wreck or your appendix bursts or you need an amputation, say.
Yeah.
They say that the anesthesia can cause you to vomit, and then you aspirate on that.
Well, that's okay. Kind of it. It's not necessarily that the anesthesia causes you to vomit, although it could. It's that if you do, you don't have any protection of your airway unless they've got you intubated. So, so when they put the tube down your into your lungs, you can no longer vomit into your lungs, but you can just make a mess of the surgery theater. But when they pull the tube out, if you vomit, then that's when you're really at risk for aspiration. In other words, stomach contents going into your lungs. So that's what they're trying to avoid. So that's why you're right. When you get in a wreck and they don't have any choice, you got a full stomach, there's just risk. And that's why emergency surgery is always inherently more risky than surgery that you've scheduled. Yeah. That's basically it. So, yeah, they just do the best they can. And if they have to, they'll just pump your stomach, too, and then before taking you to surgery.
Yeah, just in case.
Yeah. And just stick a tube down there and just hook it up to suction.
And let it rip.
Yep. All right. You have anything else on that one?
Nope.
Okay.
Hi, Dr. Steve. My name is Darren. I've been diagnosed with hereditary hemochromatosis, and I go to my blood doctor regularly. We got that down and under control now. When I go see my hepatologist, I've seen her once, and she really didn't do very much. We've done a lot of blood tests. One of the markers said that I might possibly have starting of cancer. They did the fibroscan, and I do have beginning stages of cirrhosis.
Okay. Yeah.
So I'm curious as to why she said, well, we're going to see you again in 6 months, and we'll just do palliative care. To me, I heard, let's just keep you comfortable till you die. If I got this discovered at such an early stage,
right,
that why would there be no other type of treatment aside from lose weight because of the non-alcoholic fatty liver disease? And let's cross our fingers and hope. Why is that?
Yeah. So there's a lot of miscommunication going on here. I think that the physician used the word palliative incorrectly, which I see that a lot, and the patient interpreted it in a way that they didn't intend. So people who have, say, stage 4 cancer will get palliative chemotherapy. The oncologists use that to mean it's not curable, but it's treatable. Okay. Whereas the hospice care, for example, is a form of palliative care in the sense that if all flowers, if all chrysanthemums are flowers, but not all flowers are chrysanthemums, in the same way all hospice patients are palliative care patients, but not all palliative care patients are hospice patients. Matter of fact, only about 10% of them are. So for those that don't know, palliative medicine is a medical subspecialty that deals with pain and symptom management in advanced disease and also medical decision-making. And that is a medical subspecialty, so there's even more confusion. There's about 33% of doctors out there that think that the word palliative is synonymous with hospice, and it is not. So and I believe that what this hepatologist was saying was we're going to palliate your symptoms because we can't cure the hemochromatosis, but they didn't mean I think you're dying. Now, if he has early cancer, it needs to be sent for a biopsy, and that's treatable. Hemochromatosis is a disorder in which the body builds up too much iron, and it builds it up in the skin, heart, and liver, and other glands and joints. Too much iron is kind of irritating to the body and can be toxic. And these people can end up with cirrhosis, which is damage of the liver. They can be at increased risk for hepatocellular cancer, which is cancer of the liver, heart problems, arthritis, diabetes, stuff like that. A lot of people don't know they have it. They can their skin can be sort of tan looking, and they almost can look healthy. They may feel tired and weak, though, and it's sometimes difficult to diagnose. And some people never have anything at all. And they say about, I guess, 10 out of 100 people who have this will get severe liver disease. So if your skin is a bronze or gray skin color and you have weight loss, joint pain, abdominal pain, loss of sex drive, you think it's your testosterone, but your testosterone's okay, and you're tired and weak, you think it's your testosterone, and that's okay, they may want to test you for hemochromatosis. So what you do if you find out that you have it is you get the liver biopsy. You do a thing called iron chelation therapy. This is the one time that chelation therapy actually does something positive. And you would do this if you can't have a serial phlebotomy. In other words, they'll take out pints of blood just to get rid of some of the iron, and they'll just toss it. They'll have you avoid multivitamins, and they'll have you avoid vitamin C, which seems weird, but vitamin C helps you absorb iron in your diet. So they're going to have you avoid vitamin C supplements and stuff like that. So this is something that primary care can sometimes deal with, but you're going to want a gastroenterologist involved. And if there's any sign of hepatocellular cancer, that needs to be worked up.
Yeah, sooner than later.
I don't understand.
6-month follow-up?
Early signs of, if you see anything, that needs to be worked up.
Yeah, sooner than later.
So he needs a liver biopsy.
Yep.
And then be sent to oncology if it turns out to be positive, because it's still treatable. Okay. All right.
Good question.
Yeah, really good question. Here we go.
What's up, Dr. Steve? I have a question. I got a rapid COVID test, and they stuck the Q-tip not that far up my nose, just in my nostril. And she said, yeah, you got to have enough mucus in there for us to, look at it, whatever. Hear all this stuff about false positives, false negatives. My question ultimately is, how do they know if they got enough mucus or if they got enough of your nose slime when they're looking to see if they see the virus? I guess they just if they don't see the virus, how do they know they got enough?
Right, yeah, because you can't see the virus. You're exactly right. No, it's all about technique. And if you have to follow the instructions to the T in the COVID or any other test kit. And if you don't do that, then you run the risk of having false reports. So
the test that I get every week, the at-home test, that's a rapid kit, isn't it?
I don't know. I don't know what they're doing.
Well, they do it pretty rapidly.
Okay. Do you stick it way back far into your head?
No, I do not. I just 3 times around in each nostril.
Yeah. Yeah, so there were some that you had to go all the way to the back of the nose, and those were very uncomfortable. And then they designed some new ones where it's just more sensitive, and you don't have to go so far back, and you can just do the front of the nose. And there are some new ones that I hear have not seen them that you can do in the mouth as well, so or just with saliva. So, the samples in the front of the nose are safer, particularly if someone has nasal polyps or something. You're not bumping up against those. So, if you got a negative, if you had typical symptoms with fever and all this stuff and it was negative and you really feel like, wow, I still think I had COVID-19, just repeat the test. If you get an unexpected result, the first thing to do is repeat the test. So if you expected to be positive and it was negative, it's okay to repeat it. If it's still negative, you probably really are negative. Now, we had a friend who got a positive screening test, and everybody was freaking out because he runs a business where a lot of people are, in his face all the time. But then his 2 more specific tests that came after that were negative. So that first test was probably a false positive, and that can happen as well. So when you're using screening tests, you want a test that will throw a wide blanket over everyone and catch every single case that you can get, and that puts you at risk for having more false positives. And so on those, you always want to check a more specific test to follow it up. So, for example, urine drug screens, they can be thrown off by all kinds of stuff. If you take certain stomach medications, it'll look like you're taking methamphetamine. And so when you get those, but those are screening tests.
Which stomach medication is that?
It was ranitidine, which isn't on the market anymore.
Oh, okay.
But there are other examples of things like that. And that's a screening test. So it's not very specific, but it's very sensitive. So you'll catch all the people who are using methamphetamine, but in that net, along with the tuna, you're going to get some dolphins, I guess, is the analogy I can come up with. And so in that broad casted net that you'll get all the methamphetamine users, but you'll get a few ranitidine users too. So you always take those screening tests that you run in your office and then do a more specific test like a GC mass spectroscopy or thin layer chromatography that will now weed out those ranitidines and will get it down to just the people that had methamphetamine. Now you say, why don't you just do that in the beginning? Well, those tests tend to be a lot more expensive. Mm-hmm. So if you're going to screen everybody, you want to screen them with a cheap test and then only do the expensive test on the ones that are positive. Okay, does that make sense?
Oh, yeah.
Okay. All right. Let's do this one.
Dr. Steve, I have a question. It's very simple, I think. If our body's natural defense is to raise our body temperature in hopes that would kill whatever off, why isn't there a treatment like in a hospital or whatever where they raise your body temperature? Like, why isn't going into a sauna for an hour a treatment for diseases, if you will?
Yeah.
Or am I just completely missing the picture
No,
here?
not at all.
Thoughts.
Not at all. I'll even give you one of these.
Give yourself a bill.
Now, Scott may want to talk to this a little bit because he does all that hot yoga and all that crap. The problem is that if fever was a really good defense, we wouldn't need antibiotics and stuff like that. It's just a really marginal, and it's in some ways is more of a sign that there's activity going on with the immune system than it is in any way helping it, other than if you're a little bit warmer, those cells work a little bit faster. But hyperthermia, which is elevated temperature, is a type of cancer treatment. And you expose body tissues to high temperatures, like about 113 degrees, and it shows that can damage and kill cancer cells, usually with minimal injury to the tissues around them. And I'm just looking here on a website from cancer.gov. How is hyperthermia used to treat cancer? It's almost always used with other forms of cancer therapy, such as radiation and chemotherapy. It can make some cancer cells more sensitive to radiation or harm other cancer cells that the radiation cannot damage. And when you combine hyperthermia and radiation therapy, they're often given within an hour of each other. And it can also enhance the effects of certain anti-cancer drugs. So, you've got it. Increasing temperature can be used to fight disease, just not in the way that you were thinking, I think. But they'll use it in sarcoma, melanoma, cancers of the head and neck, brain, lung, esophagus, etc. So, all right. Now, they'll do local hyperthermia, where heat is applied to a small area using a bunch of different techniques. You can use external approaches. You can use internal approaches. And then there's regional hyperthermia, where you heat up a body cavity or an organ or a limb. I remember that we used to do a type of chemotherapy where they actually dumped warm chemotherapy liquid into the abdominal cavity.
Yeah, chemo wash.
Yeah.
They still do that in some.
Yeah, and here's continuous hyperthermic peritoneal perfusion, the technique used to treat cancers within the peritoneal cavity. That's the space between the abdomen that contains the intestines, stomach, and liver. And they'll include primary peritoneal mesothelioma and stomach cancer. During surgery, these heated anti-cancer drugs flow from a warming device through that peritoneal cavity, and the cavity reaches about 106 to 108 degrees, so not enough to heat them up. Now, then to his point, whole body hyperthermia is used to treat metastatic cancer that's spread throughout the body. Can be accomplished by several techniques that raise the body temperature to 108 degrees, including the use of thermal chambers, similar to large incubators or hot water blankets, which is what he was asking about. Why can't you just get in a sauna? So, pretty interesting.
Yeah, it's good stuff.
Yeah. So it's an excellent question, and he was more right than he thought. All right.
Hey, Dr. Steve, this is Jeff up here in Seattle. You might remember the one that doesn't want to be your pal.
What?
Just had a quick question about diphenhydramine. I know it's the active ingredient in Tylenol.
No.
Some other...
that is incorrect. It is diphenhydramine is... Well, I'll give him one of these. No, that's... I don't ever want anybody to feel bad about calling.
You're not friends anyway.
He was close.
He won't be my pal. I have no idea what that's about, but diphenhydramine is the active ingredient in Tylenol PM, I believe, because Tylenol is acetaminophen. That's just basically an analgesic and a antipyretic, meaning it's good for fever and pain. But diphenhydramine is an anticholinergic medication, also known as Benadryl. Yeah. Okay. So anyway,
decongestants or antihistamines.
There you go.
But I wonder what the side effects of long-term use might be on something like that. Quite a while ago, I decided that instead of taking Tylenol PM, because I didn't want the Tylenol, that I would start taking just the diphenhydramine that I can buy over the counter to get some sleep at night.
Yeah.
I take about 50 to 100 milligrams, depending on whether it's a weekend or not. And it puts me right to sleep, and I get the best sleep I've ever had. My back feels better. A lot of things feel better, and I can sleep through the night. But just concerned about long-term effects on that, man.
I don't blame
thanks.
you.
See ya. Bye.
No, absolutely. I think it's a great question, and that is the problem with this stuff, is it works so well for people, and it's not habit-forming. And so there's no withdrawal syndrome when you stop it. But Benadryl or diphenhydramine is an anticholinergic medication. And it because of that, it causes dry mouth and dry eyes and stuff like that. And the thing is that acetylcholine, which is what it sort of antagonizes, is involved in learning and memory. And so they did a study, a team led by Shelley Gray. She was a pharmacist at the University of Washington School of Pharmacy, tracked 3,500 men and women ages 65 and older, and it was a long-term study, and they used pharmacy records to determine all the drugs and prescription over-the-counter and all this stuff that people took for 10 years. And they tracked them for an average of 7 more years after that. And during that time, 800 of the people developed dementia, memory loss of a pathologic sort. And when they looked at the use of anticholinergic drugs, they found people who used these drugs were more likely to have developed dementia as those who didn't use them. And moreover, the dementia risk increased along with the cumulative dose. So taking an anticholinergic for the equivalent of 3 years or more was associated with a 54% higher dementia risk than taking the same dose for 3 months or less. Now, this is not a prospective double-blind placebo-controlled trial. So causation and correlation aren't the same thing. So it could be that people with early dementia, have more sleep problems and they take more diphenhydramine.
Sure.
And maybe that's the association. Or it could be just that there's something in emerging dementia that causes that, and that the other people that take it are, for sleep are fine. So they feel, this is from Harvard, They say that there's mounting evidence that anticholinergics aren't drugged to take long term if you want to keep a clear head and keep your head clear into old age. Now, that was just a 54% higher risk, but there were thousands of people that didn't develop dementia in this as well. The vast majority of people did not develop dementia, so there were 800 out of 3,500. So what's the percentage? Echo, what percentage is 800 of 3,500?
800 is 22.86% of 3,500.
So 22% of people developed it, and of those, there was 46% didn't take an anticholinergic too, So I don't know. It's interesting. Well, I'm sorry. There was a 54% higher dementia risk, so we can't exactly work out the exact numbers. But there were a bunch of people that never took it and got dementia anyway.
Right.
So, but it did increase the risk. So it's about risk mitigation. And it would have been interesting if they had another group of people that didn't take it at all, 3,500 match controls, and none of them took any Benadryl at all. Would they have had fewer dementia cases? So anyway, that would be the way to do that. Mm-hmm. So you got anything to...
Well, and the other thing I see occasionally is people who take the diphenhydramines for sleep over a long period of time, they can develop restless legs, and they can certainly develop some prostatitis. They can get some BPH. So I would be concerned with those two things.
One of the first times I realized that Benadryl wasn't the totally benign medication that I thought it was when I was a medical student, and my intern was called to see a guy who was unresponsive, and he was just sitting there like a zombie, right? He wouldn't move. He was laying there like a zombie. And she was very, very good, thorough. I was at University of North Carolina, so she was pretty quality resident. And she palpated or felt a midline mass right above his pubic bone. Mm. And she correctly surmised that was his bladder, and he was having bladder outflow obstruction. So she put a Foley catheter in his penis and got a couple of liters of urine out. And as soon as his bladder drained, he sat up and went, "Wow, that really hurt." So, and what had happened was somebody had given him a shot of Benadryl, and he was an older gentleman, and his prostate couldn't handle it. So anticholinergic drugs and prostates do not mix because they will cause bladder outflow obstruction. You can't pee, and then that's a medical emergency. So, yep.
And he's kind of taking a big dose, 50 to 100 at bedtime.
Is that what he said, 50 to 100? Wow, that is a lot.
25 is one tablet, typically.
Yeah.
Typically it's in 25 milligram tablets, but if he's doing 50 to 100, I'd look at some other things.
He needs to talk.
Yeah.
I wonder if he's tried melatonin. I really, long-term effects of melatonin seem to be less severe than long-term use of diphenhydramine. Yeah. He might want to talk to his healthcare provider about that. But you hate to not sleep.
Oh gosh, no. We don't want him to not sleep, but certainly maybe want to look into some other things that may be causing his insomnia.
And there are other non-pharmacologic things you can do to promote sleep as well, including meditation. Well, that's pharmacologic. God damn it, Scott.
No, it's not. It's an herb.
Oh, okay. That's not a drug. It's an herb.
It's an herb.
It's natural.
It's natural.
Yep.
But anyway, as you were going to say, I'm sorry.
No, it's fine. I don't necessarily disagree with that. Yeah. Weed's got some anticholinergic properties too, though. It makes your heart beat fast and gives you dry mouth and all that stuff. But
makes you swimmy-headed.
So I'd like to see the long-term use of THC for sleep and see if it has a better safety profile. That'd be something we could maybe research over the next week. If there is any data like that. But there are other just non-pharmacologic things like the TRIP app. Check that out, TRIPP.com. The first time I did it, I just fell asleep. We had Bobby Kelly over.
He fell asleep.
He almost fell out of the chair.
Almost fell. We were wondering if he was asleep or not, and he started to move to the left.
And almost just went right out onto the floor doing the TRIP app. Mm-hmm. So if you've got an Oculus, get TRIPP, that app, or you can go to TRIPP.com and just read about it. And it's almost a reason to buy a dang Oculus. I'm telling you, it's the most incredible app I've ever seen. So there are things like that. There are other non-pharmacologic things that you can do to help you sleep. And I would try that. I would be nervous about just taking Benadryl for the rest of my life.
Yeah, me too.
But again, it just increases your risk. Just because you do it doesn't mean you're doomed to get dementia.
Well,
it
that
just
is a lot.
increases your risk.
That's a lot. And I know nothing, but I know that's
seems
a
like a
lot
lot.
to take.
Well, all right. Well, thanks always go to Dr. Scott. Thanks for
But
Tacie.
never to Tacie. Never.
Always to Tacie every day. I'm thankful for Tacie.
Just not her sympathy.
You can. I know. I'm sorry. I can't deal with people feeling sorry for me. That's what it is.
Can't deal with it.
But I want people to feel sorry for me. So that's also the thing. I don't know what to do. I'm a damn nut. And you knew that when you married me. And she's stretching, and oh my God, look at that. Well, you're off the hook tonight because I have shingles.
Oh, yay.
But if I didn't, just watching you do that, you'd be in big trouble. We can't forget Rob Sprance, Bob Kelly, Greg Hughes, Anthony Cumia, Jim Norton, Travis Teft, that Gould girl, Lewis Johnson, Paul Ovcharsky, Chowdy 1008, Eric Nagel, Roland Campos, Sister of Chris, Sam Roberts, Pat Duffy, Dennis Falcone, Matt Kleinschmidt, Dale Dudley, Holly from the Gulf, the great Rob Bartlett, Bernie and Sid, Martha from Arkansas's Daughter, Ron Bennington, and Fez Watley, whose support of this show has never gone unappreciated. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m. Eastern. Sunday at 6 p.m. Eastern, on demand, and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules and podcasts and other crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine.
Goodbye.
Thank you, everybody. Thank you, Tacie. You're delightful.